We never know when somebody might have a mental health emergency, and we want them to be aware that a resource exists, that if they're experiencing a mental health emergency, that they can call 988 and have somebody to talk to. 988 in Ohio is answered by Ohioans, which is important because we want somebody to be able to respond who understands the resources that are available to you, where you live or where you're calling from, and also just understand the culture that you're calling within, the local community. Crisis planning is an important part of the planning process. As we assess a person's needs, we want to be talking about their mental health needs, how healthy are they in that area of their life, and do they need supports? Are they aware of those supports? And if something changes throughout the next year, such as an immediate crisis that creates that mental health emergency, do they know that 988 is a resource for them? It's also important to know that 988 call takers are trained to serve all people in Ohio, including those with disabilities. There's a general understanding that communication might be a barrier, or that expressing the feelings might take a little longer, and asking questions that might help that person with a disability have a better experience when they contact 988 in Ohio.
The Ohio ISP is vital in addressing and planning for mental health needs because it offers a holistic approach tailored to each person. The Ohio ISP helps to identify specific mental health challenges and opportunities for support, allowing for personalized strategies that foster emotional well-being and resilience. The Ohio ISP's Healthy Living Assessment domain explores ways in which a person can be supported regarding self-care routines, ways to help a person feel supported, all the way to does a person need help making doctor's appointments? The Advocacy and Engagement domain takes a deeper dive into ways in which a person can be supported to advocate for their own mental health needs.
First, a person with a disability could call 988 themselves. They could also chat or text to 988 if they prefer that form of communication. However, not all people that we serve with developmental disabilities have the ability to communicate or make that connection to 988.
Should the direct support professional find themselves supporting a person with the 988 resource, the communications section of the Ohio ISP will help them navigate the conversation with the 988 representative.
That allows the interaction between the 988 call taker and the person with a disability or the staff who's assisting to address that mental health crisis.
The Safety and Security domain looks at ways to support a person when they are not mentally feeling their best. The Social and Spiritual domain sets up a system to ensure that a person has ways in which they can connect and stay connected with those that are most important in their lives. Moreover, the Ohio ISP planning process is collaborative, involving the person, their family, their friends, those most important to them, along with professionals, which ensures that mental health considerations are not just an afterthought, but a core consideration of planning.
In partnership with the Ohio Department of Developmental Disabilities, we've created a plain language document as well as an easy read document. We also have created what is known as a materials generator for 988. The materials generator can be used as a co-branding tool so that your agency can place your brand on that and still share information about 988. That means that it's a trusted resource for your staff and those that you serve. 988 is important for all people. Professionals who are working with people with disabilities might have their own stresses, and mental health crisis can happen to anyone. On the phone with a 988 call taker, they can talk through whatever it is that they might be experiencing. And if they need more supports, they can get a referral to local supports to meet their needs. Whether it's a person with a disability, or a professional that's supporting them, or anyone even outside of the field, mental health is just as important as physical health.